Mr. Kasim, a 33-year-old deer farm worker, came to the nearby community health clinic with primary complaints of high fever, body aches, and sore throat for 2 days. He was prescribed medications, but his condition did not improve.
Doctor, help me, please, doctor.
Yes, Mr. Kasim.
Actually, doctor, I have a very, very high fever and my body ache everywhere and I have this, what we call it? Sore throat, yes. Can you have a look at my...
Have a seat first.
Oh, thank you, doctor. You're such a nice guy, doctor.
Okay, let me check.
Are you ready? Oh, sorry, doctor. Okay, then I can have a look at my body, doctor. Okay.
I think
What happened, doctor?
nothing's wrong with your body.
Really, doctor?
Yes. I think I just give you a take-home medication and you'll be fine.
Okay, doctor. Sure, doctor. Thank you, doctor. I'll see you again, doctor.
Oh, nasi badan. Benda aku.
3 days later.
He developed severe confusion and was admitted to the nearest hospital where he became drowsy and disoriented.
Help me.
His conditions worsened despite treatment and died 4 days after admission.
Suka buat mu cek sim.
Several other patients in the same hospital had similar clinical signs. They were very ill and died within a period of 2 weeks. An investigating health officer conducted contact tracing by visiting the homes, workplaces, and other places most frequently visited by these patients that showed similar clinical signs. Contact tracing was done after conducting interview sessions with the patients affected. Note that all 12 patients, including Mr. Kasim, lived near the deer farm of TPU surrounded by orchards and wild proximity. The health and veterinary officers, together with Perilitan Department of Wildlife, visited TPU's deer farm. It was a well-managed extensive farm with an approximate population of 1,000 deer. The deer were given anthelmintic and medication for ticks. In the last 4 to 5 months, there was an increased visitation of the fruit beds and a large number of sudden deaths of wild boars. This event caused the workers to feel curious. The sick wild boars showed convulsion, seizure, and breathing difficulty before they died. Since humans and animals were both infected by the disease, biosafety measures were observed during field post-mortem, transportation and handling of specimens. Lung and brain samples from wild boar were processed to obtain 10% viral suspensions. The viral suspensions then were inoculated in Vero African green monkey kidney cell line. Electron microscopy of the brain and lung tissue samples showed helical envelope virus structure. The outbreak was declared as a national crisis. Response team from the Department of Veterinary Services immediately destroyed infected animals in affected areas. Animals in seropositive farms were destroyed. Many government agencies, national and local authorities, the police and the military forces were involved in this policy. Government agencies meet to discuss and decide on prevention and control strategies. An effective risk communication strategy was also formulated to educate the public.